So we are very glad to be on the other side of it. I remember the doctor saying, one day you're going to go, oh, she was really sick. And I'm so glad that she's so healthy now. And we're definitely seeing that. So it's been a journey, and we're glad it's over, hopefully.
Welcome to a new episode of Dysphagia Matters. We are really grateful to have had the opportunity to speak to Kristin, mother of Mackenzie, who had swallowing difficulties from the early age of 3 months. Kristin talks about their journey and how it impacted their lives and still in some ways does. You might be wondering what the cause of the swallowing difficulties is. Well, that's the big question, and just like Kristin and her family didn't know back then, we won't tell you just yet. Keep on listening and you'll soon find out. We're very happy that you approached us and agreed to share your story on our podcast. But before we dive into the topic, just in case we ask you any question that you don't feel comfortable talking about, that's absolutely fine, of course. Just let us know, and we totally understand that this is a sensitive topic. Would you like to start by introducing yourself and tell us what your relationship with swallowing difficulties is?
Sure. My name is Kristin, and I am married to my husband, Zach. We've been married for 10 years, and we have a 4-year-old daughter named Mackenzie. She has had swallowing issues since diagnosed about age 15 or 16 months, but clearly was demonstrating it before the fact, and we didn't know. So we have had quite a journey the last several years to figure out the cause of her swallow difficulties.
And may I ask what you are doing as a profession?
Yes. So I have spent the last 10 years working in human resources for various companies within the oil industry.
And you've never worked in the healthcare setting at all?
I have not.
Just so we know what your experience is before.
Sure.
Yeah, great. And of course, we would love to get to know your daughter a little bit. Do you mind telling us a little bit what she's like and what she likes to do?
Sure. So my daughter, Mackenzie, is 4, like I said, and she just completed pre-kindergarten and is starting kindergarten in the fall. So she is really into dance classes and soccer, and recently was cleared to start taking swim lessons. So that has been a real highlight for her summer to just have started a couple of weeks ago.
Nice, very active.
Yes.
And may we ask how your pregnancy and Mackenzie's birth was?
Yeah, my pregnancy, it was my first pregnancy and only one. It was overall fairly unremarkable. She had was there for 39 weeks, and I had a C-section. She was, I guess, the wrong way. She wasn't head down, and so we had a planned C-section with her at the 39-week mark. But she was a large baby, over 9 pounds. So she was quite cramped, but otherwise it was a pretty good pregnancy.
Great. So, and everything went fine also with the C-section?
Yeah, she was jaundiced, but other than that, there wasn't any other health issues known at birth.
Okay, great. So how and when did you then first find out that your daughter had feeding difficulties?
So she had always, probably from about 3 months on, we noticed a little bit of a cough when she was drinking a bottle. It wasn't often, but she started having upper respiratory infections. She had her first between 3 and 4 months old. And then about 9 months old had what they assumed was aspiration pneumonia. And so as she continued demonstrating every few months getting pneumonia, about 15 months old, we were referred to her pulmonologist. And he said, hey, have you ever noticed any maybe coughing or gagging or choking? And kind of thinking back, we said, yeah, maybe a little bit, not all the time, but sometimes. And so he ordered a swallow study, and we went for the swallow study, and she did demonstrate penetration and aspiration during that. And so she was probably between 16 and 17 months at that point. And they recommended that we start thickener and just see how it went.
Do you remember what kind of swallow study they did?
Yes, it was a modified barium swallow study.
And did they tell you anything else besides that she penetrated and aspirated on that study?
They didn't tell me much of anything. So it was a bit of a scare for us when they said, hey, here's an information sheet. on dysphagia. And that was kind of all. You need to go get thickener. I didn't know where to go to get it. I did find later that it is commercially available over the counter, as well as through like a medical supply company that you can get it delivered through insurance. For some people, that's an option, but I didn't know what kind and really had to turn to the internet because it was something I'd only really heard of, maybe thickener. One time my grandfather had a progressive medical condition, and so he was using thickener, and I just remember thinking, oh, that it looks like Jello, doesn't look appetizing. He didn't like it, and that was the only thing I knew about it. I didn't know what was the appropriate kind, and really wasn't given a whole lot of direction from the speech pathologist who did the swallow study, unfortunately.
Yeah, that really is an unfortunate thing, I guess.
Yeah.
Especially there are lots of thickeners, like you said, and how to get it. And then how did you know how thick the liquids had to be?
Well, I didn't, other than them saying, I think you need to just follow the package directions for nectar thick. Well, come to find out, we were thickening to nectar thick for probably 8 months before we were referred to a speech therapist to begin vital stem therapy. So she was closer to age 2, and she said, well, have you ever done a flow test? I said, what are you talking about? I don't know what a flow test is. And it turned out we actually had been under thickening. We weren't quite to a nectar thick. So that was, again, something that you don't know until a professional tells you later. So we were really thankful for the speech pathologist we had. We felt like once she was initially diagnosed, we were just given a piece of paper that said, nectar thick, go use a thickener, doesn't matter what kind. And really, we didn't have any support from a speech side of things. We were kind of told, hurry up and wait. Usually when they're closer to 2 or 3, they just start swallowing better on their own. Some kids are just a little immature. So I think that, we were seeing a pulmonologist, but that's not his specialty. He deals more with asthma and other things like that. So it was definitely a learning curve and lots of research, and actually found a couple of Facebook groups that were super supportive. And that's where I learned the different types of thickener and to do a flow test properly and how to do that in the IDDSI app that I'd not heard of before.
We can already hear how much you know by now. It's impressive.
I feel like it was a long learning curve.
Yes, I bet. Did your daughter have any further pneumonias after you started thickening the liquids?
It was definitely less. She was still having upper respiratory issues, but once we did repeat swallow studies about every 6 months. And when she was on nectar thick, there were not even really much penetration seen. So that's really what she needed in order to swallow properly.
What were the biggest struggles at that time? Were there also other impacts on your family life, for example, or social professional life?
I would say from a family perspective, we had never really used we'd used a daycare center, but we'd not really used any other babysitters or anyone. It was typically family. There was, luckily, having a grandfather that had been on thickened liquids. My grandmother and my parents knew of what it was and knew kind of what can happen if she were to, say, get, I don't know, Jello or ice cream or something that she could choke on. So I think it was a learning curve for my husband's side of the family, who didn't really have any experience with swallowing issues. And so once we felt like we were comfortable with everything, we could teach our family, okay, if you're going to watch her, this is what you have to watch out for. She can't have juicy fruit. She can't have popsicles, things like that. So the next phase was daycare, was making sure with the number of, they had teachers, and then they had substitute teachers that might come in for a day if someone was sick. And so really for us was making sure that everyone that was surrounding her knew what the issues were and how serious it was. Because I think a lot of people think, oh, she just chokes. She coughs a little, it went down the wrong hole or whatever. And
it happens to anyone from time to time,
right? It does. And so I think that was for them to realize, she's drinking milk. She'd had a bronchoscopy done, and they found lipid proteins in her lungs, which, was proving that she was aspirating. And so we, saying, hey, it's one thing to choke on water, but it's one thing to choke on juice and milk and things that have been sitting out, so with that, that was probably one of our biggest struggles was that. And then also, as she got a little bit older, she took to the thickener, no problem. But as she got a little bit older, it was more difficult when she just wanted a juice box like other children, at a birthday party or a popsicle, and her kind of realizing that, why can't I have those things? Why do I have to have my own cup of, you can have that juice, but you can't have it in a juice box. And so we definitely struggled with that a little bit as she started to become more aware of social situations.
How did you explain it to her?
We've always used medical terminology. She knew that it would make her choke. And we just said, this is what keeps you safe. And so being an only child, and she's around kind of adults most of the time, I think she has always kind of understood. She knew what a swallow study was. She knew that she had to have her thickener, and she knew to, as she got a little bit older, would ask her teacher, did you put thickener in this? It's, you put 4 scoops per cup or whatever it was. And so she was definitely very self-aware, and would almost be a double check if we ever forgot, or a grandparent did, she would remind you.
Very professional.
Yes.
And was there anything that helped you at that time?
So, like I said, I found a couple of groups on Facebook that were super supportive. My daughter also has hypotonia, and it's very mild, but they do think it maybe contributed a little in the beginning with her swallow difficulties, just moving the liquid around her mouth, and it taking her 2 swallows, not 1, to clear the residue. And so that was actually a group I had joined first. And whenever I found that she was having swallow issues, someone on that group, there were quite a number of children that have dysphagia or other kind of similar issues. And so they referred and said, hey, this is a really great group. And that's actually where I found out about kind of the gold standard of care that these kiddos go through when they haven't grown out of it after age 2 or 2.5.
You told us before that it was a 2.5-year journey to find a cause, and most of all, the appropriate doctors and healthcare staff. Could you tell us a little bit more about this journey?
Sure. So we continued seeing a pulmonologist, and he's been a great doctor, was super supportive. And it kind of was, okay, well, if she hits about age 2 and we're not seeing that she's grown out of it, let's do a follow-up swallow study, and then I'm going to refer you to a speech pathologist.
When was the first swallow study?
Yes, her first swallow study was around between 15 and 16 months old. So
okay, and then she was 2 years old. Okay.
Yes, and then she was just before she turned 2, she had her second swallow study.
Okay.
So about six or 7 months later.
Okay, great, thanks.
And so he referred us to a speech pathologist for vital stim therapy, which is involves kind of placing some mild electrodes that maybe stimulates as they eat and drink during the therapy. And so we continued that therapy for about 8 months, 7-8 months, and had done another swallow study. And at that point, there had not been any improvement in her swallows. It was pretty much the same. Her oral chewing skills had gotten a lot better through working with a speech pathologist. And so at that point, we moved to a different therapy provider, again, a speech pathologist, but one that focused on muscle strengthening. Her thought was maybe try something different, and had her doing various different exercises, using maybe like a sucker or a lollipop, where she's using her tongue more, and having her push and pull various like stretchy items or heavy items in order to kind of seize up the neck muscles and strengthen those. And so throughout that process, again, her oral skills increased, but her swallowing had not changed. So through all of that, we eventually continued talking to our pulmonologist about it. And he said, hey, let's rule out anything else like cystic fibrosis that's causing the chronic illness. Let's also order an MRI to make sure it's nothing like Chiari malformation or some other anatomical issue causing swallow issues. And so,
and sorry, one more question. I'm sure you were wondering the same. So where's this all coming from, right? And did you ever ask the SLPs what they thought it might be?
Yes. And their answer was generally, we see a lot of kids that have swallow issues, and it's just time. They need to grow older and stronger, and eventually they learn how to swallow correctly. So that was really, I did learn about laryngeal clefts and had asked our providers, and they said, that's very rare. If and so at that point said, how about we get a team of doctors involved? It's similar to what many hospitals have as an aerodigestive team. Our local hospital, Children's Hospital, didn't have one, but they had relationships together with a gastroenterologist and a pediatric ear, nose, and throat specialist. And so we were referred to them. And when she was just over age 3, they opted for us to have what they consider a triple scope. And that's kind of the language used to rule out things like EOE or malacias or different other anatomical issues or allergens that might be causing swallow issues. And so it was at that point, the ENT was the one specifically who was ruling that out. And he said, I really don't expect to find anything. And whenever they did come out, he said, actually, I did find a type 1 laryngeal cleft, and I used a filler, an injection filler with that called Prolarin. And he said, let's give it about a month for the swelling to go down. We'll do a swallow study and see how she does. And remarkably, she was swallowing normally with no penetration or aspiration seen. And just a month later. So to us, it felt like a big relief. Obviously, she still choked here and there where she's, not had thin liquids before. So we were able to wean down off of thickener. And the unfortunate part with a temporary filler like that is it wears off within 3 to 6 months. And so we went back in to see the same ENT, and he scoped her again and did a secondary injection with that. So the secondary injection was with a longer lasting filler, and that he said would be 12 to 18 months. And typically he does not have to redo it with those kids. But if he does, it's a couple of years later and it's with a permanent stitch. So we are now, I guess, about 15 months past her second injection, and she has been on thin liquids for over a year.
Without any chest infection or any
Yes.
pulmonary difficulties?
Mm-hmm. Without
Great.
any kind of pneumonia or anything.
Great, that's amazing. We definitely have to talk more about what that ENT did about the injections. But first, most likely many listeners, especially those working with adults and not with children, are not familiar with laryngeal clefts.
Sure.
Could you maybe explain what this is and especially how it manifested in your daughter's case?
Sure. So many adults or children, you'll hear you take a drink of water and you go, oh, it went down the wrong way, and you cough, 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 and then you feel like you could breathe again. And so with that, typically you have a larynx and you have an esophagus, and those are two separate pipes, as I like to call them, and there should be no space between those. And so with a laryngeal cleft, there is actually a gap that allows food to go, food and drink, in some cases it's food, but mainly liquids, to go down into the larynx or the windpipe in lieu of going down the esophagus like it's supposed to. And so those are classified between classes 1 and 4. And with a stage 1, like my daughter has class 1, typically you'll see mild infections, pneumonias periodically. And as you go from stage or class 1, 2, 3, and 4, 4 being the worst, those you may even have to have like an open surgery on your throat to fix. So they are more dangerous definitely when you get to a 3 and 4.
Okay, yeah, thanks for that explanation.
Yeah.
So back again to the ENT and the treatment.
Mm-hmm.
So you said he injected fillers.
Yes.
So this means that the gap that was there was filled up, right?
Correct. Yes. So he injected the Prolarin. He said typically some of them are just considered like a deep notch or a ridge where it's not really a full type 1 cleft. And so in order to see that it's not something to know they have a laryngeal cleft, they can't see it on a swallow study. They can't see it with an in-office camera down the nose to do an in-office scope. They actually have to be sedated. And he uses a tool to splay open the vocal cords and actually measure with a metal tool, almost similar to the width of a straw, down to see if that actually disappears within that notch or cleft. And so, yes, so that at that point they inject all around that area to kind of bulk it up and fill in the cleft.
I'm not sure if you know the other technique, the fees. So like you said, you can do a modified barium swallow, and then we can also do fees. And you just said that with this kind of technique, you can't see the cleft either. Is that correct?
You cannot. No,
Okay.
It's something that has to be under a sedated scope. Yeah.
Okay.
So you can definitely, I think with the fees, you can, like, my understanding is you can watch live as they're swallowing.
Yeah.
But in order, particularly if it was a larger cleft, you probably could see it with something like that. But with the type 1, they're very, as I've learned, they're also very subjective depending upon the doctor, and the treatment course can also vary, where our doctor is very conservative. And he typically will see people for swallow issues, rule out a cleft. If there is one, he'll fill it with a temporary filler and then a more permanent filler. And the stitch is the last resort, just because it is a bit more invasive, and anything within the airway is difficult to want to operate on. And so there are many other providers, from what I've read online, that a lot of them go straight to a stitch. And I think that used to be kind of the standard treatment, was if someone has a cleft, you just stitch it and move forward, where now they're not as inclined to do that, particularly our ENT. But also he said, whenever he did his fellowship, I believe it was in Cincinnati, the doctor there, his standard was, if it even looks like anything remotely like a stitch, or if maybe they're having a lot of difficulties and it's unexplained otherwise, stitch it anyways and see what happens. And so that was definitely interesting when I found out that it's not just standard. If it was a 2 or a 3, it might be more standard, but with those mild clefts, it's definitely up to the provider.
Yeah, okay, that is really interesting. And so I was just asking that because like this, you couldn't have known it any other way. So you really needed that specific assessment to find out if it was a laryngeal cleft or not. Like you said, it's really rare. In the very beginning, you said you had an idea or you've read about it. Do you remember how you read about it, or what made you think about it?
Sure. So I hadn't done too much more than initially, once they said she has dysphagia. I read about dysphagia and read, okay, there's a lot of different causes. Knowing that she did have low muscle tone as well, that we kind of thought might be a contributing factor or a major factor in it. So I read about a little boy who I think he was on, probably had to get a G-tube. I mean, it progressed pretty quickly, and it was a mom that was within one of the groups that I was in on Facebook. And she said, this is what we're doing. We're at our wit's end. He's on honey thicken, and now it's pudding, and he is still aspirating, and they don't know why. They had done all the scopes, and then they thought they found, they're like, there's a real mild type 1 cleft. And they went ahead and injected his, and within a few weeks, he was drinking thin liquids. And so whenever I heard that, I was like, wow, your story, because I had followed her story, because it really happened from birth. He was a very, very sick child. And so that was what kind of spurred me to investigate that more. And I brought it up to our pulmonologist along the way, and he said, it's so rare, just like Chiari malformation, that's very rare, and it typically is incidentally found. So he said, let's use that, kind of keep it in our back pocket as maybe a last resort to want to sedate her and go under all of that. But if it was me, I would have requested it up front, because we did do a bronchoscopy with, like, a scope with the pulmonologist. And if I knew we could have put her under one time and ruled that out, I would have much rather done that than proceeded with an MRI and a CT scan and other procedures she had to have before that.
Yeah, definitely. I totally understand. Especially if you've heard of it and everything matches. But then still, like you said, if the pulmonologist says it's really rare and it's there are other possible causes, then what can you say as a mom,
exactly.
Right? Yeah. So, yeah, you've already said that for now, the treatment is working, right? And she's doing well. Is there anything at the moment that does impact her daily living, or is she, for now, she's totally well?
Yeah, so for now she is well. We just have kept an eye on, just personally. They've said watch, and if you start to see her choking more often, she does still choke just like I do, or just like my husband does. Um, to let them know, but we keep in contact with her doctors. We still see her pulmonologist every 3 months for asthma anyway. So he always checks in and says, how is everything going? But otherwise, like I said, this was her first summer to get to do swim lessons. So again, another impact to our family was we had to be very careful when she was around water,
Okay, right,
bathing.
yeah.
And that's very hard with a toddler, especially now that she's older. It's really no big deal in the shower or the bath, but swimming had always been, she wasn't allowed to go underwater. She had to jump to us, and we had to be holding her in the pool at all times. And so this year, we just kind of had a kind of a happy, sad moment at the same time that she's nearly 5 and finally was able to go underwater and jump in the pool by herself last week. And so it still kind of impacts you in that way later, that you're seeing how much she'd gone through in order to come to this where she can just be like a typically developing child and get to have a popsicle in the summer and have juice boxes and all those things. So at this point, she's doing really well and thriving.
That's great. And did she comment on anything like this? So you said she's really aware, or you told her everything about what was not going that well. Can you maybe tell us a little bit how she is coping with it now?
Sure. So she has made comments. We started kind of an intensive swim lessons where you go every night for 2 weeks. So it kind of gets them ready at the beginning of the summer and kind of teaches them those skills very rapidly. And so the very first few days, she was a little hesitant to go underwater and said, I might choke, and still remembers even through last summer when she couldn't go underwater. So she has commented when, we called grandparents to say, oh, look, here's a picture of her swim lessons and how she's doing. She said, I didn't choke this time. And so that was good. So I think she still underlying knows that it's a big deal for her.
Okay, that sounds great. And good that she can do all these things now, finally. Do you remember what you felt like when you heard the diagnosis? What did this mean to you and your husband?
So I tend to be the one that researches everything. My husband's pretty easygoing. I'm the type A, kind of like to read about everything. And so I think it impacted me more than him. He was kind of like, okay, well, what do we need to do next to help her? Where I was, researching doctors and all the things. And so it was a little, I would say, scary at first, just not knowing how long that was going to impact her. Because I think whenever we started out on this path, I was like, oh, well, she's almost 1.5 by 2. They're saying it's pretty typical that it'll go away. And so I think we were thinking of it in months, not years. So it was kind of daunting thinking, oh my goodness, we've been going to speech therapy once a week for 1.5 years and in various forms, and we're still not there yet. And so each item that we ruled out was great. When we did a CT scan, we did a cystic fibrosis test, we did an MRI. It was great to know that we ruled out having a brain abnormality, or we've ruled out cystic fibrosis. It was a relief there, but then it was also kind of the unknown of like, okay, well, what's next? With her other kind of concurrent health issues that we were in occupational and physical therapy for, it was a little bit overwhelming.
Yeah, that sounds like a lot.
Yeah.
What was the treatment after the diagnosis? So you told us about the injections. Were there any other speech therapies or swallow therapies as well?
Not after she was cleared with the second injection and was able to come off thickened liquids. We still worked with her occupational therapist a little bit. He just, kind of kept an eye on how she was doing, and kind of visited with her speech therapist on the back end where we weren't having to come in regularly. But there's not been any other therapies needed. It was almost like an instant cure in a sense, with doing the injections.
Great. So from your perspective as a mom, which recommendations can you give us as therapists? What was helpful for you in the interaction with clinical staff?
Sure. So I think providing more in detail information, things like the IDDSI app to do a flow test, having printouts available for people on that. So instead of like, we got just here, go get, she has dysphagia, here's this. Go find that. having some kind of resources that you can email or text or walk them through how to do a flow test. And maybe secondarily to that, that kind of helps with the day-to-day, but secondarily, have some kind of like a guide that says, hey, if your child is having swallow issues, obviously you're not a doctor of pulmonology or ENT or whatnot, but having something that says this is what other patients have gone through that could be possible causes. It may not be a genetic condition that's causing a swallow issue. It may not be an anatomical brain condition. But knowing upfront what I know now, I definitely like to share things with other families electronically, or even in my local moms groups that have said, hey, have you guys ever had a swallow study? I've said, hey, I know where to go. And this is kind of what you need to say in order to get the treatment you need. So I think helping your patients advocate for figuring out a root cause instead of just taking a wait and see approach, unless they're comfortable with that. Some people might be comfortable with it and their children are a little bit older before they find out. But if it were me, I would have rather prevented having to worry about thickened liquids and bath time and all the things for that time period.
At least giving the people the choice or the offer, and then
the
they can
offer
choose
of
for
a resource.
themselves. Yeah. Okay. Was there something that was not helpful at all? So you've mentioned that the lack of explanations and resources. Was there anything else?
So not necessarily a speech pathologist outside of a hospital setting, but whenever we even went in for the airway surgeries or scopes, the first thing someone did was offer our daughter apple juice, unthickened. Here's a cup of apple juice. She's probably thirsty, where I had to re-explain. So I think maybe particularly in a pediatric setting where the child would be happy to take your cup of apple juice, just asking, are there any swallowing difficulties or something like that? Because we had to constantly explain, like, no, she can't have that cup of milk. I know she's upset. She can't have a popsicle. So that was, I don't know if that's even something that's even thought about typically in a generic pediatric hospital setting, but I think it's more prominent than people realize.
Did you ever feel that because your daughter was thriving so well and she was physically well, that this was sometimes even more difficult because you can't really see the swallowing problem until she's coughing or choking?
Absolutely. Yes. I feel like it's kind of an invisible disability until you see someone physically choking every sip in front of you. She was gaining weight well. She was growing well. It wasn't like she was failure to thrive and needing, dependent upon a G-tube. I think that if you were to see someone that is having a feed through a G-tube, you might go, okay, you might have an issue, where she looks fairly typically developing in many other areas. So I do think it kind of comes down to invisible versus visible disability, just with things like I have a brother that has autism, and that is an unseen disability. And so he can also be treated differently when people don't realize that there is an issue there. And so that definitely played a role, unfortunately, for her and in her care sometimes. Yeah.
I gotta say, I'm so impressed by how much like you use all the technical terms and apparently you've all read it on the internet, in books and everywhere. So it's really impressive. You've come a long way, I think. And it's great to see that despite the difficulties that you had, that not everything went smooth, that you finally found out what the problem is and that you found a doctor who could help her. And I'm really, really happy to hear that in the end, it seems to turn out good. Yeah. Is there anything else that you would like to tell us or the listeners, anything that we should keep in mind when working with kids in speech and language therapy?
I think meeting the kiddos where they're at sometimes. Sometimes they can be seen as another patient. And maybe if you've worked, one of our speech pathologists, she worked with the geriatric population. So she worked in a nursing or care home. And at times she would say, well, why can't just eat this or just do this? And working with kiddos, especially at the time she was almost 3, I think sometimes it's hard to move back and forth between the various populations when you're working at different ends of the spectrum. And so realizing that sometimes you're going to have to take the parent's word for it because the kids can't describe what's accurately happening, or also you may not be seeing it in a clinical setting because you see them 30 minutes to an hour once a week, where at home we're seeing it daily. And so I think listening to the parents as well is probably a supplementary thing that could be very helpful.
Yeah, that's really good advice. Thank you so much, Kristin, for taking the time and for talking to us so openly about your journey. We hope you, our listeners, enjoyed this episode as well. As always, you can follow us on Instagram at Dysphagia Matters, on Twitter at DysphagiaPcast, or visit our website, dysphagiamatters.org. Thanks so much for listening. Thank you, Kristin, for sharing your journey with your daughter. Take care, everyone. Bye-bye.
Thank you. Bye.
Bye.